today we only have, well, I only have one patient. It's a perio patient, but it's a new patient, so I don't know what to expect. So hopefully it goes well, and hopefully my patient actually shows up. So let's see what today has in store.
You can cut you like a knife if the gift becomes a fire. On the wire between will and what will be. She's a maniac, maniac on the floor.
So about 20 minutes before our clinical session starts, we have to prepare our cubicles for our patients. This includes getting sterile instruments from sterilization, cleaning and disinfecting the chair and working space, as well as setting out all our instruments and educational aids we would use towards the end of the session. We would use these to educate patients on different oral hygiene practices such as brushing techniques, flossing, mouth rinses, or any additional aids that would be relevant to that particular patient, as all our treatment is specific to each and every patient in order to help maintain optimal oral health. As you can see here, my friend and I are having a quick debrief and catch up before the clinical session starts. So for every new patient that we see, we have to do a comprehensive clinical examination, which includes medical history, dental history, social history, as well as a clinical assessment of the intraoral and extraoral features. We have to record what is normal as well as what is abnormal in order to make an accurate diagnosis. So alongside the clinical assessment that we previously did of the intraoral and extraoral examination, we have to use the radiograph in order to match the findings. Because our session was quite short, we didn't end up doing any treatment. I just did like oral hygiene instructions and education, and as you can see, it wasn't a very good session. Anyway, we got through the session. It was difficult, but we made it, and it can only go up from here. Just finished with my first patient, and it was a new patient, and we just did a history diagnosis. We didn't get to primary impressions because x-rays had to be done as well, and it takes forever at the right department because it's always such a long line. But at least we managed to get that done, and I will start with primary impressions next week. The session today went much better than yesterday. It's after yesterday. It was very nice. At least doctor was happy with my presentation, and now we can move on. So after our clinical session, we decided to go up to the cafeteria to grab a quick snack before getting into studying for our PMG test, which is in the afternoon. But as you can see, I think we did more talking than actual studying. So PMG stands for Principles of Medicine and General Surgery, which includes like head and neck pathology, endocrine system, respiratory system, nutrition, as well as cardiovascular system, just to mention a few. How was PMG?
It was chill, you know? Don't study for PMG. Waste of time.
How was PMG?
I'm not listening to jokes. I'm not listening to that advice.
Alexia, how was PMG?
I'm happy.
We're not happy with people that are happy. We studied for nothing. All of that was based off not even the work that was in the lectures. Anyway, it's done now. Got it over with. Now we move on to the next one, which is in 2 days. Okay. We are busy waiting for our food to warm. As you can see, it's spinning very fast. Oh, sorry. So on Wednesdays we have lectures scheduled for the entire day, and now we are currently sitting in the cafeteria where we are enjoying lunch. It's the only and the first break we get, which is at 1 o'clock, and we just use this time to catch up with each other and do silly things apparently. So as you can see here, I'm just setting up the cubicle for the clinical session as we do with all clinical sessions. The difference with this clinic is that it requires a lot more instruments and prep. So you have to make sure that all your instruments are there so it avoids running up and down to get everything. You need to make sure you have your curing light, your adhesive materials, your composites, which is the filling material, and all your hand pieces and burrs in order to cut the cavity and clean out all the debris and bacteria. By ensuring that you are fully equipped and as prepared as you can be for the session, it just allows you to be less stressed and work more efficiently in order for the session to run more smoothly, and you're able to then work faster and do as much as you can do in the session, because at the end of the day, patient care is still the main priority and we want to do the best that we can do for the patients. Cons clinic, which is our filling clinic where we do fillings. I have a patient today. This patient I've been working on for a couple of months now. She needs 29 fillings and I have still 21 to go. So we'll see how many we can get that I have to do. I'm hoping for at least 4, but sessions never go as planned. So here you will see me just conducting an extraoral examination, which includes feeling all the lymph nodes for any tenderness, pain or swelling, as well as detecting obviously the normal anatomy. We also check if there's any TMJ dysfunction, which is the temporomandibular joint, as that would tell us any issues relating to the jaw that would need to be addressed. So just like any other clinic where we have to do a full intraoral examination, the difference with this clinic is we have to look at each individual tooth and basically decide on a treatment plan for each specific tooth. For example, if there's a cavity on your lower molar, we have to decide the type of cavity, whether it's a class 1 ranging to class 5, and the depth of the cavity, and then we will make a specific treatment plan on how we would restore that tooth to optimal function with regards to the type of material we will use, as well as the benefit to the patient and what the patient is comfortable with. At the end of each session, we are required to make clinical notes, which includes all the treatment we had done in that visit. As you could see in the previous clip, I had done a cleaning for the patient just to make sure that all the calculus, which is hard plaque, has been removed so that nothing can be lodged subgingivally while we are restoring the tooth. If the tooth is not cleaned properly and all bacteria removed, you risk bacteria getting lodged back into the cavity, and that will also affect your treatment post-operatively, where patients can experience sensitivity and complications later on. So now we are just cleaning up the cubicle as the session is done, and my friend was kind enough to come help me clean up. And if you can see, he's saying that he does all the cleaning here and I just watch him clean. I was lucky enough to get some free entertainment and a show. So on Fridays we usually have a test scheduled for the morning, which was 8 o'clock. We had road prosthodontics, which is all the stuff relating to dentures, the materials we use, the techniques that we do, as well as the lab procedures. After the test we had a lecture on pathology, and as you can see, my friend and I aren't paying attention because we are playing games, and then we decided to actually pay attention for a few seconds. Shocker, I forgot to end the vlog, so here's future me saying I'll see you in the next one. Bye.